So this is our 360-degree view on the floor here. This computer has nothing on it. It's just charging my phone so we can see. We're gonna get to it. Okay. All right. I would start off by providing privacy for the patient. All the doors in the apartment are locked and secure. I would gather all my supplies. I'd enter the room, wash my hands, introduce myself. My name is Lucas Burton. I'm going to be your nursing student today. I would ask for the patient's name and date of birth.
Sabrina Lunsford, 10901.
I would check that with her bracelet and her medical record number. After that, I would explain to her what we're doing today, which is our head-to-toe procedure, or our head-to-toe assessment, which is where we go and make sure everything is working right and that everything is in the normal limits. So we'll start with our vitals, getting our temperature anywhere from being 97 to 100, or excuse me, 97 to 99, pulse rate being anywhere from 60 to 100, make sure that the rate, rhythm, and amplitude was the same, and amplitude would be +2. I would get her pulse ox, which would be anywhere from 95 to 100, and I would get her respirations per minute, which would be anywhere from 16 to 20, making sure that the rate and clarity and this symmetry would be the same for that. I would also ask if she was in any pain on a scale of 0 to 10, 0 being no pain, 10 being the worst pain she ever had in her life.
No.
No pain. And if she did have any pain, I would look for character, onset, duration, relief of pain. After that, I would begin her cranial nerve assessment for asking her if she had any auditory or visual impairments.
No.
Do you wear any contacts or hearing aids?
Just glasses.
Just glasses. Okay. So we'll start with the cranial nerve. Can you push up against my hand for me this way? Push up against this way. Perfect. I would check her nares, make sure she can breathe clearly in both.
Yes.
And this one?
Yes.
Perfect. I would do her pupillary constriction, doing the STAR method, making sure that each pupil is reactive to light and no more than 3 millimeters in diameter, and making sure that they cross equally and contract equally. After that, I would go to her oral cavity. She could, making sure that all her teeth, tongue, and upper palate are symmetrical and normal. Asking her to open up and say ah.
Ah.
Okay. Making sure that her upper palate is symmetrical. Seeing if she had any gag reflex, which would be the 10th cranial nerve. Asking if she could shrug up on the shoulders for me, doing the 11th cranial nerve. I would put her in a 45-degree angle, checking jugular vein distension. I would also check her carotid artery, or auscultate her carotid artery on both sides, not at the same time, also palpating as well. After that, I would check her radial pulses, making sure they are equal and symmetrical. And if she could squeeze her hands for me, that's good. Getting her to do some range of motion for me. Can you roll your shoulders forward for me and backwards? Perfect. Can you close your eyes for me? Can you tell me where I'm touching you right now?
Forearm.
Perfect. After that, I would move on to her lung sounds, making sure that they're all equal, clear, bilateral, and unlabored. I would go 1, 2, 3, 4, 5, 6, and then back to spin around. I would go 1, 2, 3, 4. Again, making sure all lung sounds are normal, unlabored, and I'm not hearing any rickets, wheezing, stridor, or rhonchi. After that, I would listen or auscultate to her chest and her heart sounds, going from her left mid-clavicular line to her fifth intercostal space. Listen to her apical pulse going up to her S1, S2, her pulmonic, and her Erb's point. Making sure that rate, rhythm, and everything else was in order. Okay. After that, I would move on to her abdomen, checking for tenderness and soreness. I would check all four quadrants for gastric sounds. So I would get her right upper quadrant, right lower quadrant, and then her left upper quadrant, and then her left lower quadrant. I would be looking for bowel sounds, listening to bowel sounds for a minute, anywhere from 5 to 30. After that, I would make sure the patient was alert and oriented, asking her, well, I already asked her what her name and her birthday was. I would ask her what date or what year it was.
2022.
Then I would ask her the situation, so where would she be at?
Your apartment.
Okay, so that all checks out. ANO times 4. Her mood and behavior is pleasant and following commands well. After that, I would move on to her lower extremities, checking for her femoral pulses. After that, I would be checking her range of motion, asking her to push up for me. That's good. Okay, if you can stand up for me. Put her right knee to her chest and move her right ankle. Good. Do the same with the other leg. Good. Range of motion is good there. If you can sit down for me. After that, I would check the capillary pulse on her full 10 digits down here, making sure they are less than 3 seconds on both sides. I would check her posterior tibial pulse, which is right here, and her pedal pulse, which is kind of hard to see, but right here, making sure that on both sides they are equal and pounding on both sides. After that, I would check her integumentary, looking for wounds, lines, IV sites, scars, dryness, temperature, moisture, or if she has any edema in her skin. And after that, I would be done, and that is our head to toe assessment.